So welcome. You join us today with my special guest, Dr. Karen Key. My name is Richard and I'm the CEO of Triple0. We're going to get Karen to share a bit about her experience of living and working and playing in New Zealand. So Karen, can you perhaps introduce yourself to our listeners and tell us a little bit about yourself and your situation?
Yeah, hi Richard. My name is Karen. As you said, I'm a GP. I got my CCT in 2017. I'm a mum of 3 girls. They're now age 9 and we have twins that are 7. I did my foundation and GP training in Yorkshire, and then once I had my CCT, we moved back to Northern Ireland, get a bit of help from the grandparents as the kids got more of a handful. And we were there for 5 years, and then headed off for this side of the world. So spent a year last year in Melbourne, Australia, and this past year in Timaru on the South Island of New Zealand.
So I guess for those people in the Northern Hemisphere, probably understanding the contrast between Melbourne and Timaru wouldn't land, but I'm sure after a bit of Google work, they'll find that out. So can you tell us a little bit, I'm interested to hear a bit more about the Australian, the year in Australia. It's something which we get asked a lot about. As you know, we recruit only into New Zealand. So a lot of those conversations do tend to lean towards, well, do you do Australia? What's Australia like? So for those listeners that are interested, I'd be keen to hear a bit about Australian experience.
Yeah, so when the idea of us coming abroad really was, my husband was finishing his anaesthetic training, and we didn't do any travel after foundation training as some people do. We just went straight into specialty training. So we always had the idea that when he got his CCT, we'd head away and do a fellowship. So when we started looking, we were a bit overwhelmed by choice, and we're big sports fans. So Melbourne was really tempting with the Formula One and the Australian Open and things like that. So we decided, well, why not just do both places? So went to Melbourne first because he had some links there where he could try and help secure a fellowship. It was really difficult for me to get work in Australia. They have a system whereby if you're a newly registered GP, you can only get work in areas of designated need, and those tend not to be the big urban areas.
Yeah.
So the closest place to Melbourne I could have worked would have been an hour away. So it really wasn't feasible with 3 kids. So yeah, Australia is very different from New Zealand. In my opinion, the Kiwis are probably a bit more laid back and chilled out, and probably a bit more welcoming. And yeah, we made friends here in New Zealand so much quicker than in Melbourne. But yeah, that could be big city life versus small town, as you kind of pointed out the contrast. But I think Australia was incredible in terms of the wildlife. You really can't beat going for a walk in the park and seeing the kangaroos and seeing the lorikeets and the cockatoos and things like that. That was beautiful. But very much towards the end of our year in Australia, we were ready to move on. It's a very different healthcare system there, possibly much more financially motivated, which I know my husband didn't really enjoy working in. Obviously, I can't comment as much from the GP perspective, given that I didn't get to work there. But yeah, just the general national identity. We were quite happy to be heading off at the end of the year. It's not somewhere we could have seen ourselves staying. Whereas New Zealand, I have to say, we've got much more mixed feelings about leaving. We're heading home this week, and I feel really sad to be leaving. So yeah, I think here is where we would have stayed if that was part of the plan.
Yeah. I mean, there's so much to cover off there. So where do we start? So moving on from snake bites and shark attacks in Australia, so traveling with the children,
yeah,
massive call, right? As you say, kind of family around you, then over here and doing that. How did you find that, and how did you find, I guess, them settling into schools and the quality of education?
Yeah, so I think probably that was part of the issue in Melbourne, is it's just such a big place. It's in any big city, it's quite easy to get lost. And I think we did feel the pressure of not really having any support with the children there. But moving to Timaru, it's a relatively small town. The hospital, there's so many expats here working. So there's this almost ready-made community waiting to welcome you. I feel like we had a little welcoming committee. Within the week we moved here, we had more friends than we had made in the year in Melbourne. and it was just really welcoming. And within a few months, the kids were off on sleepovers, and so it was just we just found that we had this little network here that was helpful to us. And I think that's just coming to a small town, that there are lots of expats around and ready to welcome people because they've made the same move themselves. School has been, the kids have loved it. There's probably more focus on sport and art and this sort of stuff than academics, which, given that we're moving back into the UK system now, I do wonder if they're going to have a little bit of catching up to do. They haven't done homework in over 2 years, so that's going to be a shock to the system
Wow.
when they go back. But they've loved it. And what's been amazing here is that the kids learn Maori in school here. So my girls now, their party trick is that they can count to 10 in Maori, they can have a little chat. So everyone at home, when they get on FaceTime, just thinks this is amazing. So yeah, that's been absolutely wonderful to see them soaking in this new culture and language. That's been really lovely to see as a parent.
Be really interesting to see how that sense of adventure plays out in their own adult lives, knowing that mum and dad were brave enough to come and do what you've done, and whether that gives them the itchy feet to try it themselves.
Yeah, I think it's very normalized, all this travel now. I think they've gotten a little bit used to it. So they think nothing of just, jumping on an airplane and flying about the place. But yeah.
And no homework for 2 years. I mean, they must be devastated to be having to move back home.
I don't think it's quite hit them yet, what awaits them.
Yeah. And so maybe, can you talk to us a little bit, Timaru, because for many people, it's not a place that they would have heard of in New Zealand.
Yeah,
But
yeah, us too. We had never heard of it until Kim and Liz got in contact and said, we've got this town where there's both an anaesthetic job and a GP job. What do you think? And of course, immediately we got Google Maps to try and see where it was and what was going on. So yeah, to be honest, it was a complete unknown to us when we came here, which was quite scary and overwhelming. But what we could see from Google Maps is that it's a fabulous jumping off point for everywhere in the South Island. You can be up at Lake Tekapo in an hour and 15 minutes. We were in Aotearoa skiing last week, so Wanaka's just 3 hours away. Yeah, up to Christchurch in 2 hours, down to Dunedin in 2 hours. So we've had just a really lovely base for taking long weekends over the year we've been here. I think I've seen more of New Zealand now than I have of Ireland. So we've really managed to get around, but Timaru's been a lovely jumping off point for that. But yeah, it was a little bit intimidating coming somewhere that we had never heard of.
Again, brave. How about the colour of that water at Lake Tekapo?
Oh my gosh, it is just, you can't explain it. It's magical, isn't it? It just changes every time you look at it. Yeah, it's one of the most beautiful places we've ever been. It's gorgeous. Yeah. We got up there, we just got here for the ski season last year. So when we arrived, we went up to Round Hill, which is a ski field beside Lake Tekapo, at like 3 or 4 weekends in a row, right at the end of the ski season last year. So it was a pretty good start to the year.
And so the children now go back accomplished skiers.
Yes, they do. Although I don't know how we're going to afford it in Europe. I think we'll have to sell it.
And I'm guessing it's not all been high points. So there's been some challenges, or some lower points. Can you talk about them a little bit, just to help us set expectations for anybody thinking about coming?
Yeah, I think, look, adjusting to a new system is always challenging. So certainly, with it, that first few months at work are hard. You're sending off referrals and maybe they're not meeting the criteria that you're used to and things like that, and you're trying to access things and it's just different, and it can be frustrating, and tasks feel like they take so much longer because you're having to try and navigate a new system. I worked in a lovely practice with really supportive people, but there's still that learning curve. I think for me as well, personally, I probably had slightly idealized New Zealand in my head. And of course, it's a country like any other. There's poverty, there's crime. I felt very safe living here, but there was definitely that moment of realization as well that, some of my patients there's a lot of deprivation and just the normal things that you deal with. So that was difficult. And yeah, it's a very long way from home. So you do feel a little bit like you're very far away. So yeah, just all of those things. But yeah, on the whole, a very positive experience.
Yeah. Is there much of a difference in the day in the life of a GP in Ireland versus New Zealand or Australia, from what you've heard around Oz?
Yeah, so I mean, I think in the UK it can be a little bit more. So let me see how how I can describe this. But I think in the UK your days can be a little bit more hectic. You see more patients and have more patient interaction, whereas here you see fewer patients. Your patient list is very much your own. So my patients really only ever saw me. So if I was away for a week on holiday, they would wait and see me the following week. And I found that quite overwhelming to begin with. And this, for me, an element of pressure there to make sure that I'm not missing anything, or because they're not going to see anybody but me. But there was the nice element of that was the follow up. So you could really see how things were playing out over the year with them. So yeah, and I think there was probably maybe an expectation because of, let me see, how do I say that? You can edit this, I suppose.
That's good.
I think because patients pay here as well, certainly coming from the NHS, I was a little bit more aware of the fact that I can't just say, come back to me in 3 or 4 weeks if this isn't working, or, you know, using time as a diagnostic tool is something we're very used to doing. But I was very aware that that's $50 for somebody to come back and see me. So it probably did mean I changed my management plans a little bit and just had to be more aware of my treatment plans.
Really interesting insight. It's something that I've never really reflected on, I guess, myself. Interesting. I mean, in terms of patient numbers that you're seeing in a day, was it noticeably different to what you would back in the UK?
Yeah, so you definitely see less patients, but the appointment times are longer. So your sessions do end up being the same amount of time. And then I think trying to fit in your admin, so having those patients being your own, you very much manage all the admin for them yourself. So the days were still pretty full and pretty jam-packed, busy in a different way, I would describe it.
Yeah. Less stressful or more stressful?
Oh, I think it depends on where you draw your stress from. I
Yeah.
definitely felt the expectation that people were really only seeing me, and it was up to me to manage all of their clinical needs and all of the paperwork and things like that. So I think different systems will play to different people's strengths. But that was definitely an element of it that I found difficult.
Yeah. Yeah. Well, it sounds like they were lucky to have you because you obviously carry their patient care really highly. If I can wind you back to the process when you first started looking to come to New Zealand, how did you find the whole immigration and medical council registration part of that?
To be honest, it was actually really straightforward. I think we'd done Australia first, and I have to say that was just painful. The registration process for Australia at many times. I think if we hadn't told the children we were moving to Australia, we'd just have given up and packed it in. It was very difficult. We were moving during COVID as well, during all the lockdowns, so I think that probably made everything more drawn out. And so by comparison to that, the year after when we were registering for New Zealand, it just felt like a breeze. We didn't have an agent for Australia. It was just direct to the hospital. So I think having Kim and Liz was just wonderful. They were just so helpful and prompt in the replies to any and all emails. So it actually didn't feel like a big deal applying. Our visa was a particular COVID specific visa at the time. But it all just seemed to come through really easy. None of that was ever a stress. Neither of us were delayed with start of work or anything like that, despite the fact that, you know, deciding to come to New Zealand and having the jobs in Timaru, we didn't have a lot of time, but it just came through really easily. So that wouldn't put me off in the slightest.
It's good to hear because often I think it's a resistance point for people thinking around it. So it's good to hear that you had a useful experience through that. So when you do go back, I'm sure you're going to have colleagues ask around the experiences.
Yeah.
What kind of advice do you think that you're going to share with them if they're thinking around doing it themselves?
Yeah, it has been an overwhelmingly positive experience for us. It's just been great. I mean, I think it's fair to say every health system is overstretched. Every health system is under pressure. It's not magical to work as a GP here. It's busy, but it's just a different system. But I think the real thing here is the quality of life that you have. Your weekends and your holidays, just you've got a wealth of places to go and explore, and to do that with my family. And my dad came over to visit in March and April, and we just went to so many wonderful places, and they're just memories for a lifetime. So whether it's considering a permanent move or even just coming for a year or two, it has been just, memories we'll treasure forever. So it's a no-brainer to think, if you're thinking about it, it's a no-brainer to come and try it, because just it's a beautiful country and it's been a really lovely place to live.
And I guess lastly, the big question for us down in the Southern Hemisphere, if you could do it again, would you choose Australia or New Zealand?
Oh, definitely to live New Zealand. The experiences we had in Australia were amazing. So seeing the Australian Open and some of the holidays that we had there were really fabulous. And just, going for walks in the park and having the rainbow lorikeets fly about and things like that was lovely. But no, if I had to stay somewhere and live somewhere permanently, it would easily be New Zealand for both my husband and I. He really enjoyed working in the hospital system here. So yeah, definitely New Zealand.
Oh, that's absolute music to my ears. Look, I want to thank you on behalf of our listeners and our team for you taking the time to share your experience with us. I know that you're packing and readying yourself to go home, but we hope to see you back here one day.
Thank you, Richard.